There are also lots and lots of options still available if you're planning a caesarean section or even end up with an emergency caesarean. There are still lots of options, lots of choices. So sometimes it's worth thinking about these beforehand, so just in case, and then helps alleviate any worries or any panics that might occur. So birth partners. You can still usually have a birth partner in with you. If there is such a scenario where a general anaesthetic is needed, then this may not be the case. So think about who you'd like in there. Usually only one is allowed into theatre, so think about who that might be for you. And music, you can often have music in the theatre as well whilst they're doing the caesarean. So music that you might want. Sometimes the surgeon themselves will put music on that they like. So you can have this discussion and find out what is available for you. And sometimes lighting. So we talk about dim lighting for helping the hormones in labour and helping relaxation as well. So where lighting can't be dimmed, where they're doing the surgery, then you can sometimes have darker lighting where your head is, where your face is, or something that can just sort of take away some of that bright light and sensory experience there. You may also be given a choice as to whether you can be awake, so you're just numbed from the sort of waist down, or whether a general anaesthetic is more suitable. There may be cases where only a general anaesthetic is suitable. So again, check this out for your situation and give it a thought as to what you might prefer, unless there's a medical need otherwise. So the screen can be lowered. So in a caesarean, then there's a screen that goes up from sort of waist upwards, so if you're led on your back you can't see anything. So some people want the screen lowered so they can see baby immediately when they're pulled out. With this you can't usually see the surgery itself, it's more to see the baby. So it's an option that you can have if that's what you would prefer. And monitors, so the picture there is for heart monitors, so they're usually put on the front of your chest. You can have these on the back, on your back if you wish. Again, this might depend on an emergency situation, what's going on, but it is something that some people prefer. So skin to skin contact can happen without wires and things in the way. So yeah, skin to skin contact is something that can still happen in a caesarean situation. Should everybody be well enough for this? Even in an emergency situation, this can be an option. So if you do want this, then it's worth sort of mentioning. A baby will be passed to you as soon as they're born. And cord clamping. So you may see in other videos talking about delayed cord clamping and what that means. You can still have this in a caesarean, and if the umbilical cord is long enough, this can still be facilitated whilst in skin to skin, but it's worth checking with the doctors themselves and the midwives to see what is actually available in your situation that might be going on. They are options. Microbiome seeding is one of these things that can be quite controversial, but looking around the research about it, it's something that can be done. So it's about, they did some research that suggested that those that were born by caesarean were more had a higher chance of things like eczema, asthma, and other sort of things like that. So they did some research on putting a swab in the vagina and then kind of rubbing that on the baby's face when they were born, and it actually improved the chances of getting those things. So it's something worth looking into if that is something that is a concern of yours. And there are other things that might be a wish of yours or preference that you've wanted that you can think about and talk about. Just By having a caesarean, it doesn't mean that all options and all choices are out of the window. It's looking at what you want and how that could be facilitated in the same way, or maybe a slightly different way that still gives you something that still helps you to feel calm and help reduce those feelings of shock and overwhelm if it's not been prepared for in the first place. So you can still have your own things and still make it an environment that you feel happy and safe in.